Dr. Christine Magezi, who will enlighten us more on mental wellness. Wait.
Good evening, colleagues. Happy International Women's Day, all protocol observed. Thanks again for this opportunity. My name is Christine Magezi. I'm a public health specialist. I'm going to share briefly what we've experienced in terms of COVID-19 and how it has affected our mental health and well-being generally. Let's see. Okay. Is my slide moving? I just want to confirm if it's moving.
No, not yet. We're still on mental health.
Okay, I may have to share again because it's not moving on my side. I'm not so sure why. Apologies for that. Let me share. Okay, let me try again. All right. So just quickly, just reflect on some of the effects that we have experienced. Most of us, we've had some of the family members get sick, others we've had bereavement in our families, there's been isolation, loss of income, as colleagues have mentioned in the by the previous speakers, and there's been a lot of fear in terms of how COVID has impacted our lives. And as a result, people have actually ended up, resorting either to alcohol, drug use. People are not sleeping well, there's anxiety, and our sister Fundi has also talked about some of the undesired events that have happened in our families where we're having a lot of gender-based violence happening. But I want to take a step back to just understand what is mental health so that we understand what comprises mental health so that we can understand at what point you know that actually you're drifting onto the other dangerous side. So there are two, just highlighting what it includes. There's cognitive fitness, emotional well-being. You need to be able to adapt to the life-changing experiences, as you know, that what we've been experiencing during the COVID times. And also you need to learn how to balance multiple roles. As mothers and women during the COVID time, we've been experiencing a lot of, responsibilities in a home. You're working, you're looking after family, and you're having to do all those other things. And also juggling with your relationship in your family. And if your relationship is not great, then you may start experiencing certain symptoms or signs. And just to say that if mental health really affects how we think, how we feel, how we act, and how we respond to people around us. So just quickly to touch on cognitive fitness, really, it means how well your brain performs its many tasks, such as memory, concentration, logic, being able to engage with others in a meaningful sense. Are you able to think through problems and find solutions, and also tackle, offer solutions using some creativity of some kind? So most people have started experiencing forgetfulness and being able to unable to concentrate, and sometimes even failing to make simple decisions in their lives. So, and then once you start experiencing more of that, you can easily tend to towards depression. So, and when you look at the component around emotional well-being, it's really looking at accepting who you are, the environment you're in and what you're experiencing, and being able to, accommodate that and express yourself in a more constructive way, and the people around you. We also look at being able to accept, again, expressing your own feelings to others openly, and having some goals that you can pursue and feel that you can participate in relationships in your environment or people around you. Going to the next one, looking at psychological health. This really is looking at how are you able to adapt and respond to the life challenges that you experience? Sometimes the experience that we've had is overwhelming. It's too much. You're unable to take it. Other people are good at being resilient and being able to, deal with situations. If you've lost somebody, you may, sort of, try to be strong, but at some point you may break down. So how are we dealing with those kind of things, and how do you respond around that? And we just want to understand that in life, even with good mental health, there may be situations when you have setbacks in your life, and there may be some positive experiences in life, but how do you respond as a human being? Sometimes even when you're happy, how do you respond so that people do not perceive you as someone who is experiencing something? So then in terms of what really as a woman we are experiencing in reality, most of us juggling a lot of things. We are in professional roles, we have responsibility to look after family. During COVID, there's been a lot of online virtual learning for students. You have to support your children, no matter the age. You need to help them to make sure that they get used to this new norm of working on laptops and tablets at home. You have community roles. You want to continue being engaged in the community, and you also have personal roles as a woman, and you need not to neglect those. So sometimes we find ourselves very challenged with all these multiple things happening, and finding a balance is really not easy. And that's why we keep saying women have to have a skill in terms of managing themselves, and also finding a balance to be able to manage their mental health. Relationships are great. It's something that really helps us to make sure that we check in with others, not just with your family, but also with friends, making sure that you keep people in your lives that are really depositing positive energy in your life, and be able to give you some kind of guidance whenever you're feeling like, you're lacking or something like that. And most of the times during this COVID situation, we have experienced a lot of burnout because you're working from home, it's your office, it's your family, it's everything, and you have pets, you have everything, and all of that needs to be taken care of. And most of the time, all the responsibilities fall on the women's laps. So I just wanted us to just quickly look at what is burnout. We need to differentiate some of the things that we experience as human beings, especially as women, and be able to, respond and be able to detect at what point am I in my life. So basically, burnout is the set of exhaustion that causes, excessive and prolonged stress if it's not managed. And it's not just an event. It doesn't happen once. It's a process. It's a gradual depletion of certain things within you. You find physically you're starting to feel drained, emotionally exhausted. Women are meant to be empathetic and caring and all of that, but you find that your level of empathy and care towards others is diminished because of burnout. And sometimes you feel there's a reduced sense of accomplishment and purpose as a person. What is the difference between stress and burnout? Let's just have a look quickly. I just summarized some of the things that perhaps we need to take into consideration. When you think about stress, usually it's characterized by over engagement. You find people trying to do so many things, trying to be overactive and overreactive. There's a sense of urgency and hyperactivity, but also there's also loss of physical energy because you're over doing it, and most times it leads into anxiety because you feel like you haven't done, your to-do list is not completed, or you have not accomplished all of that what you need. And how do we detect burnout? Sometimes burnout, if you start disengaging, you become blunt, you become disinterested, starting feeling the sense of hopelessness, loss of motivation and loss of hope, where you start feeling I'm not good enough, I'm not this, and those are kind of some of the things that you start experiencing, and then you start detaching from others. And most of the time, the causes are either work related. By work, I mean you could be working at home, family life, there's house chores, there's all of those things that actually can contribute to burnout, and also your lifestyle related issues, and a personality as an individual. Some people have different personalities where they cannot take any form of stress or any pressure. So this is just a summary of how do you know, where do you what are the areas that are really starting to trigger or show you signs of depreciating mental health. So physically, you feel tired, there's sluggishness, you start feeling sick more often, and even your appetite, you lose appetite, your sleeping habits are affected. That you might have unspecific body pains that you cannot actually, relate to anything. But when it comes to the mental and emotional state, most of the time you're becoming forgetful, absent-minded. People are talking to you like, huh, what did you say? And that's kind of, a situation. There's difficulty in feeling interested in work, even getting started to work or making even small decisions becomes a problem. You easily feel overwhelmed and burdened by responsibilities and pressure, and you feel that start falling short of your own expectation as a woman. And most of the time you feel like you're used and unappreciated, and your irritability can be felt by the people around you, and you start feeling a sense of negativity around people who are with you. Either you're feeling you're not competent enough, or people are not appreciating you. So those are kind of things that are related to that. So in terms of behavioral, there's procrastination, there is you start detaching yourself from others, de-associating yourself. You find people becoming introverts. I think someone mentioned it earlier on in the meeting. You start becoming an introvert, someone who is an extrovert, engaging others, reaching out. You start changing your own behavior. So those are some of the things that we need to look out to and reach out for help whenever you start feeling those kind of things. I'm just going to focus on one element of this slide. There's a lot of information, and I will be sharing this information, this presentation, with everybody. But I want to focus on the area when you start feeling certain things that are not right with you. That is the reacting column, where you still have some common mild reversible distress. And this is where we want to focus as women, because this, with self-care and social support, you can correct this. But if you move towards the right, where you have the injured and the ill, that means you will need professional care. You may need to be put in an institution or something like that. But the yellow column, where we have irritability, becoming impatient with others, nervousness, sadness that you can't explain, you can't relax, trouble sleeping, low energy and forgetfulness, as I mentioned, and decreased social activity. I know we've been sort of detached from other physical contact with others, but there's Zoom, there's all of these platforms where you can reach out with other people and be able to interact. Although we're also saying lower doses of social media are recommended, because sometimes people get so engrossed in being on social media all day and all night. So how can we cultivate good mental health? As I've mentioned, there are multiple factors that are really contributing to this. There's our hormones as women, stress, it's a life stage in life and life events that we're going through, our relationships, family, and even our spirituality. There are multiple factors that we need to take into consideration. But just as we pursue physical fitness to take care of our bodies, we also need to take care of our minds, because that's where all goes wrong if we do not do that. So how do we, manage this? There's a very simple concept here called basics, where you focus on your body. There's body care, and also focus on your sense of achievement as an individual. What is it that makes you feel that now I've accomplished something that makes me feel good? For me as a person, for me as a woman, what are your connections, and what are the other things that you enjoy as an individual? These are important aspects that we need to put into consideration to make sure that we remain a balanced person, and also be able to be more supportive to other people around us. So these are just very summarized and quick points to help you in terms of how you can manage yourself. Spend more time with support. Look out for family, look out for friends who make you feel good. There are people who will affirm you and you feel great. Sort of you feel re-energized. Stay away from people who deposit negative energy, because those ones just kill all the little energy that you have. We always say that if you want to succeed, if you want to grow, stay away from people who will steal the little energy that you have. So surround yourself with positive energy people, take a break as often as you can. It's okay if the dishes are not washed, take a walk. You come back, you find the dishes, nothing's gonna change. If you feel that you're really so stressed out and you just need to breathe, take a walk. And go out. Just getting fresh air will help you to, reconnect and refresh your mind and recharge. The other thing that we need also to look at is exercise. I can't emphasize exercise, enough. At least 30 minutes every day, whether it's a walk, whether you're jogging, whether you're skipping a rope or whatever, just identify something that works for you. Every one of us can do something that will increase your heart rate, that will help you with your all the cardiovascular issues that you may be experiencing. Because these days you wake up and you hear someone had a heart attack and you wonder how that person was young and this and that, but people are neglecting themselves, which is actually contributing to all these non-communicable diseases that we even didn't know that younger people could be getting. So we have to look at that. The other important aspect that we need to think about is having a good night's sleep. If you can sleep 7 to 8 hours, the brain only repairs at night. If you don't sleep, you're exhausting your brain, you're draining yourself. So the next day, if you cannot concentrate even for an hour, that's why you cannot, because the brain did not repair, you didn't have a chance to remove the toxins that the brain has accumulated over the day. Again, the other thing that you need to look at is consider joining some support groups, professional counseling. I know that, there are church groups, there are ladies groups where people just, bounce on with each other, certain challenges they may be experiencing, especially when you feel safe with that group. It's okay, you can talk about it. And the most other important thing that I want to say to the ladies on this platform, do what is right for you. Stop appeasing and pleasing people around you. Wake up knowing what is important for you, focus on that, feel good, feel happy, and it's for you as an individual. And we're all different. We do recharge differently. Some people recharge by going to the spa, others recharge by watching a movie, others recharge by reading a book. Identify something that works for you and do it. You don't have to seek permission from anyone. Just do it for you. Because if you don't, when we lose you, you leave your children, you leave your family behind. And guess what? You are irreplaceable as an individual. So you need to take care of yourself. These are just simple tips that you could actually look at, in terms of how to improve your mental health. There's a whole range of it. If you're chatting with people, sometimes instead of texting, you could decide to talk so that someone over the other side can feel your emotions and feel how you're responding. And sometimes when someone is not feeling well, when they speak, you can tell that, oh, the voice is breaking. And the other person on the other side is able to pick, oh, what's the problem? Are you okay? So those are kind of techniques to help you. And if you're texting, even sometimes people are able to pick up. I talked about reading or watching a movie, exercising. If you want to take a long bath, do it. Play nice music, put candles, be yourself, just have a good time with yourself. Eat well, limit your alcohol intake, because most of the time during this COVID time, people have resorted to alcohol, to the bottle, thinking that it's going to help. But the next day they wake up, they find the same problems. Limit your social media, indulging. Sometimes people just want to be there and, pour out and be on Facebook and all platforms. I'm not going to list the platforms. Be creative. If you can sew, if you can knit, if you can do something, that's also good for your brain and stimulate your brain. And research has shown that if you're able to do like knitting, you'll be reducing chances of getting Alzheimer's later in your life. So these are kind of things that we need to take into consideration. I just decided to put in a slide just to caution all of us and sensitize all of us. If you don't look after your mental health, we can easily end up here. 1 in 4 people are expected to suffer from mental illness in their lifetime. And mental disorders are very common across the globe, especially in the marginalized groups such as poor populations, people with chronic health conditions, the minority groups. I've just had the colleagues talking about women who cannot even access basic services. We are talking about these people in this session. It's also estimated about 450 million worldwide will suffer mental disorders in life. 75% of patients with mental illness will live in low-income countries like Africa. And in South Africa, we have about 1/5 South Africans that will eventually experience depressive disorder at least once in their life. And as we speak, we have about 23 South Africans who will commit suicide every day because of mental depression or whichever other diseases. And if these issues are detected early enough, these can be prevented. As I said, when I showed you that spectrum, if you're within the yellow column, self-care, support, and all of that can assist. So I've decided also to share some of the emergency lines. If you have any emergency or need, or who you want to reach out for a certain reason, there is information here that can be useful. So feel free to call and reach out for this information. I think this is my last slide, and I just want to thank you for all the opportunity. Madam Coordinator, Program Coordinator, Program Director, thank you so much for the opportunity. I've rushed through this presentation, but I just thought maybe let me just highlight some of the basics and things that we can relate with as women during this trying time of COVID, and where we still have to present and express ourselves as strong people and support our families, and also do well in the other jobs, and also maintain our jobs so that we don't have issues where you don't perform and then you have to be dismissed from your job. So thank you so much, Madam Director.